So you are now pregnant and you have been given a due date. What does that due date mean? Is it written in stone? Is there a chance that your baby can be born before the due date or after the due date? I think a lot of you are wondering about it. The fact is that the due date is actually based on a lunar calendar, and by that lunar calendar it was calculated a way long time back when it's saying that from the date of the first day of your last menstrual period, 280 days past that is when your baby will be born. Now, we all have different menstrual cycles. Some of us have 28-day cycles, some of us have 35-day cycles. Just by the fact of that variation, we all ovulate at different times in our cycles. So, women can ovulate anywhere between the 11th day of their menstrual cycle to the 17th day or 18th day of their periods. So just by the fact of that, your conception can actually vary. So when we say that exactly 280 days beyond the first day of your last menstrual period, then in itself we are not being super accurate. Beyond that comes the fact that a lunar calendar actually has variations in itself. So somebody did this calculation for me, and so we know that if you actually go by just the lunar calendar, that itself, if you look at the 40-week time frame, comes to 295 days and not 280 days. So again, we are looking at a vast variation in when your baby can actually be born. So from a care provider perspective, we always think about the baby being born as a due month, not really a due date. So somewhere between the 36th week and the 42nd week, your baby can actually be born. By the medical conventional terms, 37 weeks is term, but usually by 36 weeks, if the baby is ready to be born, the baby is the one which sends a tiny hormonal signal to the mother's body, which then takes that up and says, well, I'm ready to be born today. So it's the baby who decides the date of birth and not any artificial calendar. The other things that we know from long-term, looking at women and their birth cycles are that first-time mothers, they go more than 10 to 14 days beyond their due date, which means an average gestational period for a first-time mom can be around 41 weeks plus, not necessarily more close to 40 weeks. So again, when you look at that time frame, a first-time mom can expect to go a little bit later than what her so-called due date has been given. The other things that can influence your baby's due date can again be the level of maturity of that baby, and like we talked before, the baby sends out the signal. So a baby who has grown faster and is more mature will send out that signal sooner, and that he or she needs to be born earlier. A baby who is less mature will send out that signal later, and that baby will be born later. So when we talk about due dates and say my baby must be born on week 40, that doesn't really seem to make that much sense. And so when we are talking about in the current scenario, what we are talking about in the current scenario is, should your care provider say, I will let you wait only beyond a day or so beyond your due date, or a week or so beyond your due date, you should be able to question your care provider and say, what happens if I wait beyond that? Are there things to determine that me and my baby are well, so that we can allow to really let the baby finish their gestational period inside your womb? And usually babies are very smart, and they are the ones who decide as to when they are ready to be born. We also know that baby's brain development peaks at that point of time. So there are actual charts and visuals showing what the baby's brain looks at 37 weeks and 39 weeks. And so that baby's brain, if you cut off a few weeks of that baby simply because we are putting an artificial date on that baby's birth, we may actually be cutting off the amount of brain development in that child, reflex maturation, as well as babies who are born when they are ready usually have much better birth weight, have less feeding difficulties, and so on and so forth. I want to end this with one more statistic that we do have. We know that only 4% of babies worldwide are born on the date of birth. About 15% of babies are born within -1 week or +1 week. And a huge, humongous 85% of the babies are born -3 weeks or +2 weeks. So all I would say is think of it as your due month. Think of it as a batch of popcorn. There are poppers which pop exactly at 2 minutes, and then there are poppers which pop maybe a little early, and then there are poppers which pop at 3 minutes. So think of that and give the baby the maximum time in the womb that's best for you and